Welcome to Pennsylvania Newsmakers, and thanks for watching. Well, the role of hospitals, Pennsylvania hospitals in the COVID-19 response. But first, what do Pennsylvania citizens want? We'll get to that after these words.
Welcome to the fast-paced and unrehearsed weekly discussion featuring the leaders who help shape your world. Join us as we address the issues that impact you each and every day. This is Pennsylvania Newsmakers. And now, here's your host, Terry Madonna.
Well, what a week in American politics and government. Quite a week with the inauguration of a new president, Joe Biden, obviously. And we're going to talk about some important Pennsylvania subjects. Joining me to do that is Bryan Cutler. He's the Speaker of the House of Representatives. Last week, we had the governor of Pennsylvania on, Tom Wolf. We're committed to having both Democrats and Republicans on this program, liberals and conservatives. We're going to get all points of view. Mr. Speaker, welcome to the program.
Thanks for having me.
Well, look, let's start with obviously Joe Biden gets sworn in, a message of unity to all Americans. Interesting question. Are you Republicans listening? You like how I put that? Are Republicans listening? Take it.
Yeah, we have been for some time, Dr. Madonna. Actually, when you look at the last session, when I started the session as leader, and then we moved near the end, I moved up to speaker. We had passed over 700 bills out of the House. Of those, 96% were bipartisan. I think about 65% were unanimous. So the truth is, at least here on the local level, your political affiliation really has very little bearing on our ability to work together. And thankfully, we're not as dysfunctional sometimes as Washington, D.C. is. And overall, we had approximately 250 bills signed into law by the governor. And I expect this session will continue to be the same in terms of working together on behalf of all of our citizens.
Yeah, I'll tell you, one of the things that we keep reading about and hearing about are personal relationships and how important they happen to be in government, as you know quite well. And it doesn't seem as though in the Pennsylvania legislature, Democrats and Republicans, particularly on social media, aren't beating each other up as much as they are elsewhere. So you have to have decent personal relationships to really be effective and to get something done. Or am I on Mars about that?
No, not at all, Dr. Madonna. Actually, I would point everybody to my two speeches over the last two times that I was sworn in as speaker, both times unanimously by motion. And it really is about relationships. It was no mistake that a very good friend of mine, probably one of my best friends in the legislature that I've had in my entire time and tenure there, now Judge Brandon Newman, Democrat from Washington County, was who I had in both times to swear me in. We sat next to each other on the House floor for a term. We became very good friends. I've been out to visit him and his family, and he has been in to visit mine. And those kinds of personal relationships always transcend any kind of political differences. The truth is, and as evidenced by the bills that we passed, we have far more in common than I think sometimes is reported. And I think that commonality is what will continue to focus us on being successful going forward.
I'll tell you, it seemed like an odd situation where Joe Biden wins the state by 80,000 votes. The Republicans pick up two of the three row offices, state treasurer and auditor general. And then you have this situation where in your chamber, you pick up two seats, you'll correct me if I'm wrong. And what does that say about what Pennsylvanians want out of their government?
Well, I think particularly at our level, it really is about the local candidate and the issues that drive local politics. We've all heard the saying that all politics is local. I think that's probably most prevalent at our level. And we actually netted 3 seats. We picked up 4, but lost 1 in Montgomery County and Philadelphia. And so we netted 3 to move the majority up to 113. And I think that's an endorsement of the approach that we took last session that produced those large numbers of bipartisan bills, as well as those unanimous bills. And please remember, last session, while the first half really started out, right out of the gates, very strong on workforce development, within a year, we were all focused on responding to the COVID epidemic, which for some unknown reason became very politicized. And despite that, we still were able to pass bipartisan bills working with the governor. Some were vetoed, which is certainly, that's within his constitutional powers, but it's also within our constitutional powers to exercise what we believe the people want, because we are the people's house. And we sent all of those bills to the governor, and we were able to do so in a bipartisan way. And I expect that to continue.
We're going to run to a break. When I come back, I want you to look ahead a little bit in the next couple of months and what the citizens of Pennsylvania can expect of their governor. All right, we'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Well, my guest is Bryan Cutler. He is the Speaker of the Pennsylvania House of Representatives and an important person to ask this question to. What's going to happen in the Pennsylvania legislature in the next couple of months? What are the important issues that you all in the legislature have to grapple with?
Well, I think first and foremost, we have the continued response to the COVID pandemic and how to safely and responsibly open businesses. That was something that really dominated the last half of the session, so the last year roughly, at the conclusion of last session. That will continue in terms of reopening the economy. I think also looking at schools and how we're delivering education to our students. As a parent, that's something that I'm very concerned about. I have 2 kids in high school, 1 in middle school, and we'll also be looking at the budget. That starts February the 2nd. That will be the kickoff of the official budget season with the governor giving his budget address. It looks like it might be slightly modified in terms of ceremony this time, but government will continue to function and will continue to work for the people.
I'll tell you, one of the more controversial considerations that could come up has to do with appeals courts. We talked about this before. You're the appropriate person to talk to. And that has to do with we elect Commonwealth Superior and Supreme Court justices statewide. And folks in your caucus, in the Republican caucus, are nervous, and other places are nervous about the fact that the urban areas, you would argue, dominate, particularly the Supreme Court, and are talking about electing appeals court judges out of districts. And, that has to be done quickly in order to get it on the ballot for this year's primary. What's your response?
Well, let's back up and give a little bit of background. I think it's important. You're right. The urban areas tend to dominate our statewide courts, which are there are 3, and 66% roughly of those judges come from either Allegheny or Philadelphia County. So that is certainly an issue that many folks in the mid-state have raised. I've always personally had concerns with the way that we do partisan judicial elections. I've been a big supporter of merit selection. I was the prime sponsor for several sessions. Representative Paul Schemmel now has that bill, which would essentially mirror the federal process where the governor would nominate and the Senate would confirm. Because I think one of the reasons you end up with over 2/3 of the judges coming from those 2 counties is typically voters are not as aware of judicial candidates. And just because you have high name ID or you can raise a lot of money doesn't necessarily mean you're going to be a good judge. And that's something that I've always personally raised my hand on in terms of the money and the political influence in our courts. And I think that is an area of concern. Sure. I think merit selection, would also be a constitutional amendment. Unfortunately, we didn't have the votes to advance that last session. This was the one that won. And ultimately, with any constitutional question for the viewers' information, it has to pass a General Assembly 2 consecutive sessions before it goes out to the ballot. And in many cases, I personally view it as should we advance that question to the voters? And as a believer in small government and local control, I believe we as voters always have the right to advance constitutional questions and evaluate the form of government. And so I think that one will be debated, probably healthfully.
Yeah, I think it's complicated, and you're exactly right. In the polls that get done on appeals court elections, the voters know very little about them, and the candidates for these appeals courts and judges in general, common plea, local judges, they're not allowed to talk about issues that might come before them. And so it's difficult, and they don't often have money to run statewide campaigns. In about a minute that we have left, what's your message to Pennsylvania right now, given this unique time in American history?
Yeah, regarding our position at this snapshot in time, it's really the same message that we had all of last session, which will be, as Speaker, I'm a constitutional officer, will defend the legislative prerogatives and the legislative authority that is vested in us in the Constitution. We're going to work hard on behalf of the people. And through the deliberative process, we're going to produce bills, many of which will be unanimous, a lot of which will also be bipartisan, because that is the legislative process. Right. That's the job that we've been tasked with.
Right. Well, look, I want to thank you for coming on. You're welcome on this program anytime. All right, coming up, how important are hospitals in fighting COVID-19? I think all of you know, but we're fortunate to have the president of Pennsylvania's Hospital and Healthsystem Association of Pennsylvania joining us, and we'll do that after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Cross-State Credit Union Association. Credit unions, where people are worth more than money. To find a credit union that is right for you, go to ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is brought to you by the Association of Pennsylvania State College and University Faculties, representing the faculty and coaches who are devoted to providing quality public higher education for Pennsylvania's college students.
All right, joining me is Andy Carter. He's the president and CEO of the Hospital and Health System of Pennsylvania, Association of Pennsylvania. I'll tell you what, you folks are the real heroes in the hospitals. I know you hear that all the time. I have no clue the kind of pressure and how much anxiety must exist among the workers in your hospitals, all the personnel, not just the physicians and the nurses, but I mean, how's it all going?
Well, no question, these are heroes, and they've earned their designation as heroes. And there are almost 300,000 of them working in hospitals across the Commonwealth. From physicians to food service workers and environmental service workers, they are keeping their patients safe.
Yeah, that's great. Well, let's start out with what should the public in our state, the citizens in our state, know about vaccines in PA?
Well, two things. One is, let's remember they're safe. They've been through a rigorous testing process and review process. We know that Pennsylvanians are nervous, many of them are nervous about the safety of the vaccine, and I'm here to remind all of us that they are safe for Pennsylvanians. The second thing is we don't have enough doses. We're facing a critical shortage. We're optimistic about the new president's plans to dramatically increase availability, and we have to get moving because hospitals, health centers, physician offices, they just can't get the job done if they don't have the doses. 100
million doses in 100 days. No, I'm happy that he's ambitious about it. Make no mistake about it, but it's connected to the $1.9 trillion stimulus package that he wants, and I don't know how that could be controversial. I mean, I don't know whether he can achieve it or not, but give me a break. I mean, this is critical to the lives of all of us.
Well, we have to get those doses moving, and the president's plan seems to include features that will get it moving, including invoking the Defense Production Act, which will help make resources available to increase the pace of manufacturing of these vaccines. Yeah. And then we have to just get them into the field. That's a demanding task in its own right. But without those doses, all the plans that hospitals and other providers make start to fall apart. You set up clinics, You set up appointments, and then the doses don't arrive. You have to cancel thousands of appointments. So that's why we have to really be patient as we look forward to this.
And I know lots of folks have tried even now to get the doses. You know, they've now added people 65 and over and people with certain conditions to phase 1. And they're told weeks and maybe months. Weeks
and possibly months if the supply doesn't stabilize and grow. And that's where, again, the message about patience. The announcement about the increased number of people who are eligible for the first phase.
Yeah.
Well, it's reassuring, of course, to know that you're eligible. But the sad thing is that until those doses are on site, we just can't address the 3.5 million people who today in Pennsylvania are already eligible.
Yeah, I mean, and that's, and I'm glad to see that that President Biden has said that's the top priority. He has a whole list of priorities, but I don't think there's any doubt. And the role that hospitals play are so critical in that. It's an extraordinary role that you all play. And are you optimistic? Maybe I shouldn't ask this question, but are you optimistic about the future with this?
Oh, absolutely. We know what we need to do.
Right.
If we didn't have that idea, then I'd be worried, and I wouldn't be optimistic. But we know the plan. Hospitals and other healthcare providers are ready to go, but we need more resources. I said we need the doses of vaccine. We need people. I mean, 12.8 million people need to get vaccinated eventually in Pennsylvania.
Yeah.
And we do not have enough staff. Now, one thing I want to be careful about to remain optimistic is that we have to, as they say, walk and chew gum. We have to be able to move vaccinations forward. At the same time, we have to keep treating patients.
No, you make a good point. We're going to run to a break, and when we come back, I want to talk about the vaccine rollout and the patients and what Pennsylvanians can do, and we'll get to that subject and more after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine.
All right, we're going to continue our discussion about the role that hospitals are playing in COVID-19, and it's real. They've assumed an extraordinarily important public health role.
Absolutely. Just to date, we've put about almost 500,000 shots in arms, and we are treating patients who fall ill under COVID-19. There are almost 5,000 patients in Pennsylvania hospitals. And we are stepping up to help address this crisis by being able to serve the broader community and provide those shots. And we do have a long way to go, as we said earlier.
Yeah, I mean, you've got two important roles. You're giving the vaccine, let's start with that, and you're testing. I'm going to add a third one, and then you have to deal with patients who have COVID. I mean, have hospitals completely reorganized what they do to deal with this?
Well, we definitely have had to be nimble and to be responsive.
I like that word.
I mean, the good news is that we're all working together to try to control the spread of the virus, and we're seeing important signs of progress. For example, just a month ago, we had over 6,000 patients in inpatient settings. Now we're down to under 5,000. And a big reason we've been able to do that, and I know you do this, you take it very seriously, is we wash our hands, we maintain social distance. You and I have plexiglass separating us, and we're taking extraordinary precautions to wash our hands at every turn.
And these, right?
Mask
I'm holding up
wearing,
my mask. I'll put it up. The camera's on.
It is critical to continue to take these prevention steps, and that will help us continue on the downward path. And eventually, look, it's going to take longer than any of us want it to take. And just rolling out the vaccines, we estimate that it'll take until the end of February before all hospital workers are vaccinated. And then all of the folks that are in the 1A category, around 3.5 million.
And they've expanded it.
They have expanded. Now we have about 3.5 million people in that category. That's going to take a few more months just to get through them. So the idea that we will be working on vaccinations, hospitals, community health centers, other providers, And the Commonwealth is going to be stepping up at some point, as they're doing already in Philadelphia, mass vaccination sites at huge parking lots and such. That's the kind of work we're going to have to be doing. And hospitals are a huge part of it.
Yeah.
We are essentially, in many communities, the de facto public health department in their communities.
I don't want to get into the weeds with this, but the role of the Pennsylvania Department of Health, explain because they're critical in terms of operational regulations, and they work between the federal government and the state government. It's their role, and you deal with them on a regular basis. Well, explain that.
Absolutely. Well, the State Department of Public Health acts largely as the principal public health entity in most parts of the Commonwealth. Some counties have their own health department, but most in Pennsylvania do not. So we work closely with the administration, and particularly the Department of Health, to try to coordinate this vaccine rollout, to coordinate the outreach to the communities, and to make sure people are educated about when vaccines are going to be available. What we don't want are Pennsylvanians placing lots of phone calls to providers hoping to be able to get their vaccine. We need people to wait to be told when vaccine clinics are available so that we can schedule them. Otherwise, we just have mass chaos. And we're trying to coordinate with the Department of Health to avoid that kind of chaos.
How concerned are you now? In the last couple of days, we've read that the spike could be over. That I just saw the look on your face, and I know. And I mean, are you concerned that Pennsylvanians, Americans, that we're going to let our guard down and somehow get back to a normal routine and have another spike?
Let's be honest, we're all exhausted by the precautions we're taking about the loss of social contact. The fact is, the infectious disease professionals that I talk to every day are very worried about one more significant resurgence, particularly associated with this new strain of the virus that is believed to be far more infectious. So we cannot let our guard down as much as we want to. We have to be vigilant until we get the all clear. And I'm afraid that's still months away.
Yeah, we have about 30 seconds. A lot of people think that, or experts think that this could go on for years.
Well, the strain of virus is likely to continue to be around for years to come. But if we achieve significant rates of vaccination, it won't be able to get that toehold that creates the pandemic problem.
Thanks a lot. All right, thanks. As always, thanks for watching Pennsylvania Newsmakers, and you all stay well.